I'm going to talk about feeding practices today that relate to weight development in children. On the one hand, you can think of positive feeding practices, and some examples are structuring meal times or engaging children in food preparation, and also making sure that when the child grows up, they become more independent. For example, giving them more choice about what to eat and the food selection. There are also responsive feeding practices, so you could think about parents responding promptly and in an adequate way to the cues that the child sends, so for example around fullness and hunger. And we know that these relate in a positive way to the weight of the child. On the other hand, you have non-responsive practices. They're also called controlling practices or coercive practices. And two examples could be restricting the types of food that the child eats, or allowing them a certain amount to eat. Another example is pressuring the child to eat, and you could think of those that we mostly want them to eat more of, like fruit and vegetables. And we know that these controlling practices are related to negative weight development and eating. So now if we want parents to support their children in healthy weight development, you could think about ensuring that the parents use the controlling practices a little bit less and rather focus on those that are more helpful. And again, thinking about setting up a routine and having regular meal times, engaging children in the preparation of food or teaching them something about the food they eat, and then also finding alternatives for using food for bribing or as a reward. And we know this doesn't work for everybody, especially if the child is a little bit older, they're set in their ways with the parents on how they interact around food, but also genetics or medical conditions. And so we're still interested in testing how some of the factors related to genetics, the environment, the family, and child characteristics impact how the weight development of the child progresses. And eprObes is greatly suited to basically answer some of these questions.